get just like the most adorable, like little puppy and kitten home, there's so much joy and there's so much excitement. And then you realize just how much care they need.
The amount of care in that first 12 months is fairly extensive. Whether it's vaccines, fecal screening.
It also helps you get their spay and their neuter in, and during that time we usually microchip as well.
And without some guidelines and without, you have so many questions, you don't know where to go, you have the internet, you have lots of influences. And so a care plan is really to help you give all the resources that you need by your trusted veterinarian, and outlines all the little things that you have to do along the way.
And with the care plans, it's essentially no interest payment plan, budgeting tool to spread it out over 12 months, because we know that the cost for that first year of life is going to potentially be really high compared to when they're 2, 3, or 4 years of age.
Preventive care is super important for our senior pets because our pets do age much quicker than humans do. So making sure that we see them more frequently so we can check their blood work, make sure the doctor has a physical exam on them, because things can pop up pretty quickly on them, and if we catch them quick enough, we're able to manage it a little bit easier.
Say kidney disease, for instance, if we have like blood work on a prevention plan, one that we use had STMA in it, for instance, and that's something that'll show early kidney disease. If I can afford to do that blood work with a plan, now that disease will be detected earlier, which means that I can do diet changes. I can, do different things to kind of slow the progression of that disease down.
They might need to come to the vet more to, evaluate their organ function on a more regular basis. They might need some more regular dental care, or maybe their heart is having signs of progression if they're prone to heart disease.
With that, could come a fair amount of expense for our clients. By enrolling in a care plan, having that conversation, setting the tone for the next 12 months, and then giving them a tool to spread out the cost instead of having more expensive one-off visits, allows them to kind of pick what's most important to them, but also budget appropriately over the 12-month span. And I think ultimately is going to open up access to that senior pet population.